The 7th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become finalists. Let's learn what their superpower is.
We have been with PointClickCare since 2016. In fact, we're pretty proud of the fact that we were the pilot site in Northern California to introduce the concept of using ED optimization within the Bay Area in Northern California. And when the proof of concept demonstrated there was significant return on investment, then Sutter said, yes, we're going to encourage this to be rolled out to the entire system. Those who look in Care Everywhere often are overwhelmed by the volume of entries and trying to find the entry that actually has information. So you're filtering through 40 visits trying to find information that's useful. In the emergency department, nobody has that level of time. We just wanted insight into who these high-risk patients were. And then once you start getting data from people outside your catchment area or other health entities, you begin to understand there was a little hubris there, that you were just seeing it for so long, you just assumed that you knew it well. I think that was a real eye-opener. And you begin to understand that, oh, I have to change my thinking. Or maybe there's more insight or more subtleties into this than I initially appreciated. Right now, we're able to look at things such as how many times do they come back. We're starting to get a handle on what's their length of stay when they come back. And now we measure our success or the optimization of it in different ways, but we're always looking for new ways to do that. Most busy EDs are going to have one complex, either Munchausen's, malingering type. Everyone has one of those patients that come in once a year. If you identify them right away and you prevent that admission on that patient, you've probably paid for the tool for the year.
Now hear in their own words why they should win.
Hi, I'm Hamid Husseini, Chief Medical Officer at PointClickCare and a practicing emergency physician. Clinicians in the emergency department deal with immense pressure to make fast, accurate decisions for patients who often arrive without a complete medical history. That's why PointClickCare developed a solution purpose-made for emergency departments. PointClickCare delivers real-time, actionable insights within seconds of a patient's registration in the ED. These alerts are seamlessly integrated into the ED track board, giving care teams immediate access to critical information, from diagnoses and medications to care plans and safety events, even if that patient has been seen at other facilities outside of their system. This is particularly important for post-acute patients transferring from skilled nursing facilities or who may have recently had a SNF stay. We deliver a concise, structured view of the patient's post-acute stay up to the point of transfer to the ED, including the SNF facility and provider details, admission date and diagnoses, code status and emergency contacts, and the last 14 days of administered medications, all delivered instantly into the ED workflow when the patient arrives. Our proprietary reason for transfer AI model uses natural language processing to extract and summarize the most relevant SNF EHR clinical notes from the 24 hours leading up to the transfer. This model surfaces the likely drivers for transfer and delivers it in a clear, consumable format. We designed this to reduce unnecessary tests, treatment or readmissions, but at the very least, streamline that care to minimize unwanted outcomes for the patient. We empower clinicians to deliver more informed, efficient, and patient-centered care for the most vulnerable patients coming to the emergency room.
Follow their journey as they strive to become a finalist against a very strong field. Join us October 20th for the final showdown at Health in Las Vegas to witness the winners crowned.